Hi, my name is Marin, and I'm here to talk to you about some pregnancy exercises and stretches you can do prenatal and postpartum. It is super important to stay in shape while you're pregnant. Your body is changing, it's adjusting, it's doing new things. You have to stay strong, flexible, agile, and firm so that your body can recoup and bounce back as efficiently as possible after you give birth. You also want to make sure you have a lot of good energy and strength to be a mom and recover at the same time once your baby's born. So let's do a couple of these exercises, and the most important thing is to make sure that you feel comfortable doing any and all of them and that you have good clearance from your doctor, healthcare provider, or your midwife. If you feel any sharp pains or discomfort that you feel like is not right or too uncomfortable, it's really important to stay really sensitive during this time and not push it past that limit. You don't want to compete against anybody. You don't even want to compete against yourself. You just want to make sure that you're doing this to take care of your body and your baby, and you want to do it as safely and properly as possible. So the first exercise we're going to talk about is Kegels. We've all heard of them, but do we all do them? I don't know. I certainly don't. But I really wish that I did more often because it is so important to strengthen those pelvic floor muscles. Those are the muscles that go from your lower core down into your pelvis and right up behind your butt muscles there. So in order to make sure that we're doing this properly, you want to first identify which muscles those are. If you're not familiar which pelvic floor muscles are, make sure you try to use the restroom and stop your urination, mid-urination, and you'll see which muscles those are. Those are the muscles we're using. Once you practice a little bit of squeezing them, you can find a comfortable place to sit or lay. You can do this in traffic or at the office, but you can just sit down and focus on squeezing those muscles. It's not so much about the abs, although you will feel a little bit contraction in the lower abs and you'll feel a little bit of contraction in between your glutes, but you're really gonna focus on contracting right underneath there inside the pelvis. Then exhale as you contract, and then inhale as you relax and let go. So you want to exhale, contract a little bit, then inhale, relax. Do anywhere from 10 to 20 repetitions before relaxing and doing it again. Eventually you want to feel really comfortable with 50 to 100 repetitions of these Kegels. When you get there, focus on holding the Kegel, and then imagine an elevator inside your birth canal. So if you sit down and do this Kegel, then you think that's at floor 1, try to squeeze that Kegel up higher to floor 2 and squeeze even higher to floor 3. You're gonna feel more squeeze in between your glutes. That's totally normal. You wanna squeeze back there and squeeze right under here. But do that and hold it for a good 5 to 10 seconds before relaxing for a good amount of time and doing it again. Try to repeat that anywhere from 10 to 30 times, and you'll get better as you go. This is a really effective exercise that we really all should be doing all the time. It's gonna help you with continence, it's gonna help you with constipation, it's gonna help with healing and everything else, staying nice and firm, and also having your baby birth with more ease and less pain and risk for injury. A lot of really good motions that you can incorporate is pelvic tilts. If you get on all fours, you can do some rotations and side to sides as well as up and downs. I really like the up and downs and all the pelvic tilts. These are really good for reducing constipation, reducing lower back pain, strengthening your hips and your pelvic floor. And it's also lubricating the joints in between your hips, which are constantly expanding and moving during this whole process. So make sure you sit here and do it for a while. You can also do them on an exercise ball. So getting on an exercise ball and rotating side to side, round in circles, make sure you go both ways, counterclockwise, front and back as well. And if you still feel comfortable enough, you can also do these just sitting on your glutes right here. And yes, you're gonna feel like you're dancing. So like I say, put on your favorite music, your favorite song, and just jam out to this nice little aerobic exercise for your hips. Really, when it comes to pregnancy, you should be able to do any exercise or stretch that you're comfortable with. Some people feel a little less comfortable. Other people feel like they can go above and beyond. When I was pregnant, I was still able to do cartwheels, ride a bike, perform yoga like the scorpion pose all the way right up till my 3rd trimester. But again, it just depends on where your fitness level is to begin with. You don't really want to push your body or do anything new while you're pregnant. But if you're already comfortable with it before you're pregnant, feel free to continue doing so until it becomes uncomfortable, or until your mommy brain says, hey, that's not safe, I don't like that, or your healthcare practitioner or midwife says, don't do that. So one of the greatest things that you can still continually do is squats. If you can squat just like normal, as you get bigger, this might be a little more difficult. You might use a chair or a wall, or your partner can hold your hands as you squat up and down. It's a really good partner building relationship too. If you can squat all the way down, this is an excellent place to be during pregnancy and during birthing, really. If you can get here, this is going to shorten your birthing canal. It's going to make it easier for your baby to labor down and come through. You might not necessarily give birth here, but during labor, this is a highly effective position and a relieving position that you can get into. Even if you can't get all the way, using an exercise ball to squat down, or a low stool or a chair is a great position to be in. So feel free to either hold this, grab a stool or a yoga block, sit on it, and even focus on doing slow squats up and down if you can. Aside from all the normal exercises, learn how to modify your exercises. If you're used to doing walking lunges and you don't feel stable enough to do that, then focus on static lunges. Use a chair or a table to hold onto and just go slow. Move slowly, keeping that core tight, breathing deeply through every motion, and just making sure you don't over push yourself. Again, this is not a competition. You really just want to make sure that you're keeping your body healthy and strong, but you're not really just pushing it to be a first place marathon runner, or trying to necessarily see how many you can do for how hard you can do it during pregnancy. That's not healthy for you or your baby. So make sure you stay low and modified. And again, if you feel comfortable doing the normal movements like normal push-ups, do them. But if you need to, modify. And if you need to, modify more. And feel free to do some of these things like push-ups on the wall or stretches on the wall with support from a partner or a chair or the wall. It is super important to stay flexible during pregnancy. Your body is stretching in all sorts of ways. The last thing you want it to do is fight tension. So flexibility, circulation is really huge when it comes to pregnancy. I love doing things like raising my legs and rotating my hips out like this. If you feel comfortable doing these kind of things, or little jazzercise type stretches, these are really good. A lot of hip rotations and a lot of core contractions, focusing on strengthening that core, not through full sit-ups, but through just contracting it in all you do. If you're doing small crunches, if you're doing dog pointers are really great for pregnancy. We gotta get all these hips strengthened, all these glutes strengthened as well. So lifting each leg here in a tabletop position, you can also alternate arms and legs, and you can also hold these if you prefer. Don't forget to lift up, rotate around as well. Love these little rotations. And again, while you're here, go ahead and you can do pelvic sways and cat-cows as well as rotations. Really, really good to work those hips, strengthen the core and everything below for pregnancy. As far as stretches go, you should do any of the normal stretches that you feel comfortable with. If you can stand and do quad stretch, or hold on to a wall or chair and do quad stretch, you can do that. Some hip stretches you can do is standing with your legs apart and gently, basically what you're gonna do is you're gonna kind of corner stand. So it's not like completely apart. You're gonna step out to the side and then out to the back as well. And then gently push into this hip. And you're gonna feel that stretch here. If you wanna deepen that stretch, raise that arm and bend away from that back hip and that straight leg. You should feel that stretch deep in the hip. Only do this if it feels comfortable. If you're feeling sharp pains or shooting pains into your uterus or back, stop it immediately. Also, don't forget to stretch your glutes. I love doing this in a chair, especially if you're pregnant. This is a great place to do this in a chair. Place your upper ankle above your upper knee, flatten that knee out, sit up nice and tall, and gently bend from the waist. You're gonna feel that stretch deep into this glute. Hold it for 5 to 6 deep breaths. Make sure you switch sides. Aside from all this, downward dog is a good stretch to do during pregnancy. You don't have to be great at it. You can just be here, pushing your torso away from the ground and straightening your legs. Try to get your heels to the ground and those knees straight. And you can rock back into plank. Try to hold each pose for 5 to 6 deep breaths. You also want to make sure you get your neck and your shoulders. It's so important to relieve that tension. So when we're here in a seated position, you can go ahead and do any neck stretches that you know of, taking great care and ease. Try to hold the stretches so that your body gets a chance to actually relax into the stretch. You can go down and up, look side to side, and even look down to the side. I'm placing my hand here above my head, not to pull it down, but to put a little bit of weight on the back of my head. Gravity is going to naturally deepen that stretch with just the weight of my hand. So make sure you're not pulling your neck down in any sort of situation. Also, sitting down in this pose, it's a really great place to stretch out your shoulders. Just walking back very gently, bending at the elbows. You get a really nice shoulder stretch here. So whether you're pregnant, working on being pregnant, or you just got done having a baby, I highly recommend, especially at this time, to stay on top of your diet, exercise, and stretching. If you need to join a pregnancy yoga class or hire a trainer to do so, do that, or get yourself educated online. I cannot stress enough how vital and important it is for the ease of your pregnancy and labor, as well as your becoming into motherhood, to be in the fittest shape possible. My name is Marin. I hope you enjoyed this video on exercise and stretches during pregnancy, and if you're pregnant, congratulations. Thank you so much for watching. I hope you found value in this video.